Good afternoon, and I'm very pleased to be here. It's my pleasure to share with you this course, and I thank you all for allowing me this opportunity. And our talk today is going to be on drug handling in hemodialysis. We're going to review the principles of pharmacokinetics, and we'll discuss the effect of impaired kidney functions on these pharmacokinetics, and also in relation to extracorporeal therapies. And then we're going to discuss drug dosing, and we'll have special considerations. First, to start with the definition, pharmacokinetics defines the process of drug absorption, distribution, binding, and elimination. And pharmacodynamics represents the interaction of drugs with its target site or receptor, and the pharmacological response that results afterwards. So when the patient takes a drug orally, it's going to be absorbed, and then it will undergo first pass to the liver, and then it's going to be distributed to the tissues and reaches the systemic circulation, where protein binding is going to take place. Mind you that it's only the free portion of the drug that will exert its effect at the tissue receptor, and it's only this part which is going to be cleared by dialysis. Then after that, the drug is going to go back to the liver for metabolism and elimination, and also to the kidney for clearance. So these are the steps of drug pharmacokinetics. You have absorption and you have distribution. And the volume of distribution will depend on the drug dose in relation to the blood concentration. If you have a big or a large volume of distribution, this means that little amount of the blood of the drug will be present in the blood. So in this case, little drug will be dialyzable, and probably this drug is going to be lipid soluble. This is if you have a big volume of distribution, and the reverse is true. Then we have the protein binding, and then metabolism and renal handling. So these are the steps. Now let's see what happens to each of these steps when impaired function of the kidney occurs. First, with the absorption, there is going to be a decrease in the drug absorption, because those patients have nausea and vomiting, they have gastroparesis, and because of the alkalinizing effect of the salivary urea, which changes to ammonia, so this will impair the absorption of drugs that need an acidic medium. And the same thing occurs due to the use of proton pump inhibitors and H2 receptor blockers that we usually give our patients. And also the use of phosphate binders will form insoluble complexes with many of those drugs and will impair their absorption, and also you have gut edema. So this is what happens in absorption. What about distribution? Your patient will fall in one of two categories. Either there's going to be an increase in the volume of distribution due to the presence of edema or ascites, or there is going to be a